Your doctor will do a physical examination and question you about your symptoms to identify angina. Additionally, any risk factors, such as a family history of heart disease, will be discussed with you. The following tests are used to identify and confirm angina: electrocardiogram, ECG or EKG, ECG or EKG. The electrical activity of the heart is measured by this rapid and painless examination. Electrodes are applied to the arms, legs, and occasionally the chest in the form of sticky patches. The electrodes are connected by wires to a computer, which shows the test findings. If the heart is beating too quickly, too slowly, or not at all, an ECG might reveal this. To determine whether blood flow through the heart has been slowed down or interrupted, your healthcare professional may also look for patterns in cardiac rhythm. A chest X-ray: the health of the heart and lungs can be seen on a chest X-ray. To find out if other illnesses are causing chest pain symptoms and to check for an enlarged heart, a chest X-ray may be performed. A blood test. When the heart muscle is harmed, as in a heart attack, certain heart enzymes enter the bloodstream. These chemicals can be found via a blood test for cardiac enzymes. Stress test. When the heart is working harder, diagnosing angina might occasionally be simpler. Usually, a stress test entails using a treadmill or stationary cycle while having the heart rate monitored. A stress test could be conducted concurrently with another test. If you are unable to exercise, you may be prescribed medications that have heart-healthy effects. Echocardiogram. In an echocardiogram, sound waves are used to produce images of the beating heart. The blood flow through the heart can be seen in these pictures. A stress test could include echocardiography. Test for nuclear stress. Blood flow to the heart muscle is measured during a nuclear stress test both at rest and under stress. Similar to a standard stress test, a nuclear stress test involves injecting a radioactive tracer into the patient's blood. How the tracer travels via the cardiac arteries is visible with a specialized scanner. Low or absent tracers in certain areas imply inadequate blood flow. Computerized tomography of the heart, CT. Typically, during this test, you recline on a table inside a donut-shaped apparatus. The apparatus's X-ray tube rotates inside the body to capture images of the chest and heart. If the heart is enlarged or if any heart arteries are restricted, a cardiac CT scan might reveal these conditions. Magnetic resonance imaging of the heart, MRI. This examination produces fine-grained pictures of the heart using radio waves and magnetic fields. Usually, you will be lying on a table within a long, tube-like machine that creates precise images of the blood arteries and the structure of the heart. Cardiovascular imaging. Coronary angiography employs X-ray imaging to see within the blood arteries in the heart. It is a procedure in the broader category of cardiac catheterization. To inject dye into a cardiac artery, a medical professional threads a thin tube, catheter, through a blood vessel in the arm or groin. The dye enhances the visibility of the cardiac arteries on an X-ray. Your doctor may refer to this kind of X-ray as an angiography. Treatment. Treatment options for angina include alterations in way of life medications, vascular surgery and stenting, heart surgery, open, coronary bypass surgery. The objectives of treating angina are to lessen its frequency and severity as well as the risk of mortality and heart attack. If you experience unstable angina or angina pain that differs from your typical angina discomfort, you should seek emergency medical attention. Medications. Medication may be required if lifestyle modifications, such as eating well and exercising, fail to improve heart health and reduce angina pain. Among the medications used to treat angina, nitrates. Angina is frequently treated with nitrates. So that more blood can flow to the heart, nitrates relax and widen the blood vessels. Nitroglycerin is the kind of nitrate that is most frequently used to treat angina. Under the tongue is where the nitroglycerin tablet is put. Your doctor may advise taking nitrate as a long-term prophylactic measure or before activities that frequently cause angina, such as exercise. Aspirin. Because aspirin lessens blood clotting, blood can flow more easily through constricted heart arteries. Blood clot avoidance can lower the risk of a heart attack. Never begin taking an aspirin every day without first consulting your doctor. Clot-resisting medication. Blood doesn't clot because certain drugs, including clopidogrel, Plavix, Prasugrel, Efient, and Ticagrelor, Brilinta, reduce the likelihood that blood platelets will adhere to one another. If you can't take aspirin, One of these medicines might be advised. Beta snubbers. Beta blockers reduce blood pressure by causing the heart to beat more gradually and gently. These drugs also help to enhance blood flow by relaxing blood arteries. Statins. Drugs known as statins are used to decrease blood cholesterol. A risk factor for heart disease and angina is high cholesterol. The chemical the body requires to produce cholesterol is blocked by statins. They aid in preventing blood vessel obstructions. Blockers of calcium channels. Calcium antagonists and calcium channel blockers relax and expand blood arteries to increase blood flow. Other drugs to lower blood pressure. Angiotensin-converting enzyme, ACE, inhibitors and angiotensin II receptor blockers are additional medications for lowering blood pressure, ARBs. Your doctor could advise one of these medications if you have high blood pressure, diabetes, heart failure symptoms, or chronic renal disease. Ranolazine, Rainixa. For persistent stable angina that doesn't improve with other drugs, this medicine may be administered. It can be taken either alone or in combination with other angina drugs such as calcium channel blockers, beta blockers, or nitroglycerin therapies. To improve blood flow to the heart, a non-drug approach termed enhanced external counterpulsation, EECP, may occasionally be suggested. Cuffs that resemble blood pressure monitors are wrapped around the pelvis, thighs, and calves during EECP. Multiple treatment sessions are necessary. For EECP, EECP may assist those with persistent, uncontrolled angina in reducing their symptoms. Refractory angina. Surgery and procedures. It may be necessary to have a catheter operation or open heart surgery if lifestyle modifications, drugs, or other treatments are unable to relieve angina pain. The following surgeries and methods are employed to treat angina and coronary artery disease. Stenting along with angioplasty. An extremely small balloon is put into the constricted artery during angioplasty, also known as a percutaneous coronary intervention, PCI. A small wire mesh coil, stent, is typically introduced after the balloon has been inflated to expand the artery to keep it open. Angina is lessened or eliminated after angioplasty with stenting. If lifestyle modifications and medicines are ineffective at treating chronic, stable angina, angioplasty with stenting may be a useful alternative. Heart surgery, open, coronary artery bypass surgery. A blocked or congested heart artery is bypassed during coronary artery bypass surgery using a vein or artery from another part of the body. The heart receives more blood after bypass surgery. It can be used to treat stable angina, as well as unstable angina that has not responded to conventional therapy.
For any questions, leave a comment below and don't forget to subscribe.